Hello and welcome to another episode of Health Talk from Marz. It's out of this world. In today's episode, I want to talk to you about food allergies and all the very many symptoms that are associated with food allergies. So, if you want to learn more about some of the more remote symptoms connected to food allergies, stay tuned. Did you know that many pain syndromes, such as rheumatoid arthritis, osteoarthritis, gallbladder pain, migraine headaches, can be connected specifically to some sort of food sensitivity? There's other conditions, such as recurrent infections, that would be recurrent bronchitis, recurrent sore throats, recurrent, any types of conditions can be related to food sensitivities. So, what do we know about food sensitivities and food allergies? First off, I'd like to delineate the difference between a food allergy and a food sensitivity. A food allergy specifically denotes having an immunological reaction to a food. That means that your body's producing specific antibodies towards that food. So, a food sensitivity denotes having a reaction to a food that may involve any number of different mechanisms. Sometimes the mechanism is unclear, and it's just we know that a food is causing a reaction. Part of the problem with diagnosing food allergies or food sensitivities is that oftentimes a reaction to a food does not necessarily occur each time you eat that food. So that can get really confusing. And what reason do we have to explain the fact that one time you eat a food and you have a reaction, and then another time you have no reaction? Well, the answer lies in the fact that underlying all food sensitivities are a number of different pathological conditions that may predispose you to having a reaction to that food. So, obviously, something like a stress on the body. It could be an emotional stress. It could be some type of injury that you sustained from an accident. So, these things could predispose you to be sensitive to a food. Also, if you're exposed to some type of environmental sensitivity, such as a cleaning solution or a perfume or some type of agent that's being used in the house that you're exposed to, could be as something as simple as car exhaust outside your door. So these are things that oftentimes aren't considered when looking at food allergies. Things like chronic parasitic infections. Many people have chronic parasitic infections and have no idea that they harbor some type of parasite. So, in those cases, people don't have the usual symptoms such as diarrhea or nausea or other types of symptoms. Sometimes they can have joint pains. So, things like rheumatoid arthritis may actually be triggered by being exposed to a parasitic infection that you've had for a number of years. And so the object is to try to get rid of that parasite so you decrease your sensitivity to a food. Another thing that's really common is that people are exposed to various types of heavy metals. So mercury, lead, arsenic, cadmium, these are all possible triggers for food reactions that you might have. And the only way to really know if you have these heavy metals is to check for them. Checking for them can get a little tricky because these heavy metals like to inhabit certain tissues of the body. Mercury likes to accumulate in the central nervous system, the thyroid gland, and the adrenal glands. Lead likes to accumulate in the bones. And so measuring in the bloodstream does not really tell you how much is actually in your tissues. In order to get an accurate representation, one has to do some type of chelating agent and then collect urine over a period of time to get a more accurate reading on how much of these heavy metals you have harboring in your tissues. So you can see that clearly there's a number of things that need to be looked at when you're looking at food sensitivities. So food sensitivity testing can involve different types of methodologies. Skin testing, which is a traditional type of allergy testing, is clearly one of the least effective at diagnosing food allergies. It's been shown that food reactions connected to positive skin tests are less than 50% associated. Basically, that means that you might as well flip a coin. Some blood tests that measure antibodies may just give you an idea of how much in the way of food allergies you have and not tell you about food sensitivities. There are electrodermal tests such as Vols or Vega that can give you accurate readings for different types of more subtle food sensitivities. So, one of the things that we know is that, as mentioned, there can be a number of factors that weigh the scale towards having a reaction towards a particular food. So, what's the best way to go about treating these food allergies? Well, one, certainly getting an accurate diagnosis, which involves making sure that you turn all the stones over to see what's underneath them. And when I say turn the stones over, that may involve certain blood tests that may show that you have high tissue levels of iron. We know that high tissue levels of iron can predispose one to having inflammatory reactions in the body. So that would be high levels of ferritin or high levels of the percent transferrin saturation, which gives you an idea how much iron is in your tissues. Treatment-wise can be rather tricky and sometimes a little complicated. So there are a number of techniques that can be used to rule out the possibility of food sensitivities or food allergy. By far, the most accurate methodology of testing for foods is to do avoidance and then reintroduction. But avoidance of a particular food may involve avoiding a food for as many as 3 to 6 weeks. A good example of trying to determine if a group of foods may be sensitive is in the case of certain types of arthritis conditions. So certain people with arthritis are sensitive to the nightshade family of foods. So the nightshade family of foods includes potato, tomato, paprika, cayenne, eggplant, and peppers. So these foods may trigger a reaction in the body whereby causing acute or sudden joint pain. And avoiding foods in the nightshade family may involve avoiding these foods for at least 3 to 6 weeks. So the antigenic components of these foods, it's possible, can stay in the intestinal tract for over a month. Therefore, when we're trying to see whether or not you're having a reaction to a food, having that avoidance period be at least 3 weeks, if not more like 6 weeks, is ideal. So when you avoid these foods for this period of time, you create a situation in which the body will become super sensitive to those foods. So let's say you avoid nightshade family for a period of 6 weeks. Your joint pains get markedly improved, and things seem to be going really well. At that point, it's good to establish whether or not the nightshade family of foods is causing a problem. So the first thing that I would recommend is to do some potato, a small amount of potato. And by that means like maybe a quarter of a potato baked. And then wait a few days because it may take a day or two or more to have a reaction to that food. Then you repeat the dosage, but only on a higher basis. So maybe you have 2 baked potatoes. If there's no reaction to the 2 baked potatoes after the second reintroduction, then you're probably safe from that food. Now, I mentioned that there's a number of foods in the nightshade family, and they include peppers, and they also include eggplant and tomato. So it's possible to be sensitive to one food in the family and not another food. So if you don't have any reaction to the reintroduction of potato, then next you could try tomato and see what happens after introducing tomato a couple of times. And then you can go to peppers. Now, not all of the foods in the nightshade family have as much in the way of the toxic compounds that can cause joint pain. And this compound is called solanacin. So, for example, potatoes, which have turned a little bit on the green side on the skin, have a higher level of this toxic component, solanacin. So when you're testing for food, having green potato is actually going to be more beneficial in testing to see if you are indeed sensitive to that nightshade compound, solanacin. Green peppers have a significant more amount of solanacin compound. That's the compound that can be toxic to your joints. Red peppers have only a small amount of solanacin. So if you're trying to test more accurately the level of solanacin and what level causes a toxic reaction that causes your joints to hurt, then I would select green peppers. Ideally, if you're diagnosing food allergies, as mentioned, the most accurate way is to do provocative testing. That means to avoid a particular food and then bring it back into the diet some 3 to 6 weeks later. Now, another method that's clearly very effective in treating many severe types of food sensitivities is fasting. Fasting is by far the quickest way to eliminate possible food allergens from inside your digestive tract. Usually when I have people fast, I have them also take in some bentonite clay. Bentonite clay is an adsorbent that binds onto endotoxins in the GI tract, rendering them non-toxic to the body. So doing a short fast, and it could be even 3 days, may be sufficient to have a dramatic effect. For example, I've treated a patient recently who had migraine headaches almost every day for a year. We decided that we would put this person on a fast, put him on a 3-day fast, water fast, and at the end of the second day, their migraine headache completely disappeared. And so that was an example of really eliminating as many allergens as possible. As mentioned, usually it's not just one food that you're sensitive to, but usually it's a combination of foods or a combination of a food and some type of toxic element like a cleaning solution. Could be something that you're getting from your bed, such as dust mites. So dust mites may predispose you to have a food sensitivity and a reaction to a particular food. We mentioned also stress. Stress plays a key role in stimulating the allergic response in the body. A perfect example of this is something called mast cell activation syndrome. Mast cell activation syndrome is a condition whereby your mast cells start to react to something that's unknown. So when we say unknown, it means that we haven't really pinpointed it down, and it couldn't be any number of things. So mast cell activation, we know, can be triggered by various foods, but also, as mentioned with food sensitivities, could be environmental allergies as well. An alternative to fasting and single food elimination would be to go on a hypoallergenic diet. A hypoallergenic diet is a particular eating regime in which you avoid major food allergens. So there are certain foods that are generally speaking going to be much higher in terms of the incidence of causing allergic reactions. And they would include eggs, dairy products, wheat, especially gluten, could be pork, could be beef, and soybeans also is pretty common. Peanuts right up at the top. So what do we know? We know that foods that people crave intensely are usually foods that people are allergic to. And also foods that people hate are also foods that they're allergic to. So it acts on both spectrums. So as children children that hate particular foods, something that you should definitely pay attention to, and it may be an indication that they are sensitive. Now, of course, many kids don't like things like spinach or broccoli unless it has cheese whiz covered all over it. Um, that's a little bit different, but safe to know that paying attention to food cravings, especially food cravings, can definitely tell you a lot. So when I'm treating a child for food allergies and food sensitivities, I usually ask the kid what their favorite foods are. Many times they'll say pizza, which involves dairy products and gluten. So that's a double whammy. Or maybe they love eggs, or maybe they love bananas. So paying attention to specifically food cravings and strong food dislikes can give you important clues as to whether or not someone's sensitive to a particular food. So if I look at someone's diet diary and I see that they're eating the same food 2 or 3 times a day, that's a pretty good indication that that food needs to get eliminated. I remember as a child, most likely I was sensitive to gluten and wheat products, and I grew up eating wheat products probably at least 2 to 3 times a day. So in the morning for breakfast, we had cereal, and we had eggs with toast. And, for lunch, I always had a sandwich, which consisted of gluten and usually cheese. And then, at night, usually had some type of carbohydrate, some type of dessert that had gluten in there. So those are classic symptoms, or those are classic signs that you probably are sensitive to a particular food. But there's many symptoms that may be associated. We mentioned about some things that you might not consider, such as gallbladder pain or joint pain. Chronic infections may be related to food allergies. Also, what we see, canker sores or bruxism. Bruxism is grinding of the teeth at night, may be related to a food sensitivity. So one important item to keep into consideration when doing a hypoallergenic diet is that anything can cause symptoms. So that means that toothpaste, for example, there's a compound in toothpaste called sodium lauryl sulfate that may be a trigger for certain allergic reactions. So using something like baking soda may be more advantageous if you're trying to really eliminate all possible food allergens. So eliminating toothpaste, spices. So we recommend for people to avoid all types of spices during a hypoallergenic diet, except for sea salt. Sea salt is generally considered to be inert and pretty safe, but things like oregano or dried basil or dried curcumin, any number of spices, oftentimes contain molds. Molds can be a trigger for food reactions or food sensitivities. So make sure that during your hypoallergenic diet, you eliminate as many possible allergens as possible, and that especially includes dried spices, and just use sea salt. Also, water that you take in should be free of chlorine and also fluoride. So using some type of filtered water is good, or distilled water might be even better during the period of fasting. So again, keep in mind that any number of different possibilities there are for allergens that can trigger a host of reactions in the foods that you're eating. So, and remember to take careful notes. So taking careful notes during this process of food elimination is really essential to determine what reaction that you might be having towards a particular food. And again, as I mentioned, it's a good idea when you've avoided a particular food for 3 to 6 weeks to bring it back in a very small amount, and then a few days later, bring it back into a much larger amount. And so what we see here is sometimes just a small amount may not trigger reaction, but introducing a larger amount may start to trigger the allergic reaction in that particular food. Thank you for watching another episode of Health Talk from Marz. It's out of this world. If you like what you heard today, click like and subscribe. If you want to know more about products that I have that may be related to allergies and the treatment of allergies, go to marznutrition.net and check out my product called OxyQuench, which is a multi-antioxidant formula specifically designed to treat allergies. Thanks for watching, and I'll see you next time.